Hello and welcome to another episode of Health Matters. I am your health coach, Dr. Michael Chillemi. And in this episode, we are going to talk about something that is in the news today and is getting a lot of questions. I have a bunch of patients ask me, say, hey, doc, what is this? How do I understand this a little bit better? I said, you know what? Let me just go ahead and do a podcast on this so I can really do a deep dive. So on this episode, we're going to get into a condition that affects millions worldwide, chronic venous insufficiency, or CVI. Have you ever experienced swollen ankles, aching legs, or varicose vein? This episode is for you. We'll explore the causes, the science behind it, and how you can manage or even prevent it. We'll look at what CVI is, the anatomy that underlines this condition, how it affects your day-to-day life, and a detailed breakdown of the treatment ranging from lifestyles to different therapies and options that are out there. We're also going to get into the classifications of the categories. So we're really going to give you a good amount of information. So sit back, relax, and let's get into it. What is chronic venous insufficiency? So, chronic venous insufficiency is a medical condition in which the veins in the legs are unable to effectively return blood back to the heart. This happens when the valves in the veins, which usually prevent the blood from flowing backwards, become damaged or weak. So basically, the valves in your veins and or your walls become either too weak or they become too big, and you get backflow. So key facts. The condition predominantly affects people over 50, and it is more common in women than in men. It is classified as a chronic condition because symptoms are persistent and progress over time if untreated. The most notable symptoms include swelling, pain in the legs, heaviness, varicose veins, or skin discoloration. Let's get into segment 2, which is the anatomy of CVI. So how veins function. Blood flows back to the heart through a network of veins located close to the surface of the skin, superficial veins, and deeper veins within the body, which are called deep veins. Veins are equipped with one-way valves to prevent blood from backflowing due to gravity. What goes wrong with chronic venous insufficiency? In people with CVI, the vein walls or valves, or both, are weakened and damaged. This leads to venous reflux. This is a situation where the blood flow leaks backwards and pulls into the veins rather than circulating effectively. Over time, this increases the pressure on the vein walls, causing swelling and inflammation. The role of the calf muscle pump. So the calf muscles act as a pump to push blood upward. Lack of movement or weakening of these muscles can compound the problem of venous insufficiency. So it's important to get those legs moving, get those legs pumping. Got to keep them strong. Okay, so first question is, next segment 3 is, how common is chronic venous insufficiency? So around 40% of adults in the United States may develop some form of it. Risk factors include age. It becomes more prevalent over the age of 50. Gender. Women are typically at a higher risk due to hormonal influences and pregnancy. Lifestyle. Sedentary behavior or prolonged standings increase the risks. Weight. Obesity puts added pressure on veins. And lastly, family history. Genetics play a significant role. So next segment that we're going to get into the detailed symptoms of CVI. So CVI is a progressive condition, and its symptoms can vary from mild to severe depending on the stage of the disease. We're going to go over some of these symptoms right now. So I'm going to go over some basics, and then I'm going to get into some of the classification scales. So early or mild symptoms. In the early stages, symptoms may appear to be subtle or dismissed as general fatigue. These early signs should not be ignored as they indicate impaired blood flow and the beginning of venous dysfunction. Leg discomfort or sensations. leg heaviness or fatigue. The legs may feel heavy, especially after prolonged standing or sitting. I have patients that explain this feeling as you didn't really do that much, but you feel like you're walking with a weight around your ankle. Swelling or edema. Swelling occurs typically in the lower legs and ankles by the end of the day. It tends to decrease after a period or after you elevate your legs or rest. Aching or pain. A dull ache in the lower limbs, often described as a sense of throbbing or tightness in the legs. Pain typically worsens with prolonged standing or sitting. Learning to spot early warning signs. These symptoms are usually the most apparent at the end of the day and improve after raising your legs or taking a short walk. If left untreated, they can definitely progress into a more severe stage. Intermediate symptoms. As the venous insufficiency worsens, the symptoms become more noticeable and start to interfere with daily activities. At this point, you may observe physical changes in the legs. Skin and visual change are available. You might have varicose veins. Varicose veins are enlarged, twisted, rope-like veins that protrude beneath the skin. They are often bluish or purple in color and predominantly visible on the thigh or calves. You might also have spider veins. Spider veins are tiny web-like veins that appear close to the surface of the skin. While not harmful on their own, they do indicate venous distress. Swelling. The swelling becomes more persistent and doesn't subside as easily as it did in the early stages. This is considered pitting edema, which means when you press on the swollen area, it leaves an indent for a few seconds. So if you have swelling in your leg and you push into it, usually the color should come right back. When it doesn't and it stays pushed in, that is pitting edema. Pain and muscle issues. Pain worsening with activity. So unlike arterial problems, CVI pain worsens when sitting or standing for long periods and improves when you walk or elevate. So if you have CVI and you walk, your symptoms will get better. Why? Think about it. You're moving your legs, you're getting the blood to pump, and then that's causing the pressure to bring them back up. Because when you're sitting, your ability of your venous system to bring them back is not there. Muscle cramps or spasms. So you may experience sudden shutting cramps in your feet or calves during the night, and this may disrupt your sleep. Let's get into your advanced symptoms. In the advanced stages, the symptoms escalate and complications arise. At this point, there is significant damage to the veins and the surrounding areas. You might have severe edema, swelling. The swelling becomes a chronic, constant, and no longer alleviated by rest or elevation. It begins to cause tenderness, skin tightness, and changes in mobility. Skin problems. You might have chronic venous dermatitis. The most distinctive advanced symptoms are related to skin damage caused by long-term venous hypertension, increased pressure in the veins. You might have hyperpigmentation, brown or dark discoloration of the skin, especially around the ankles. This occurs because of an iron buildup as red blood cells leak into the surrounding tissues. Stasis dermatitis, skin becomes red, inflamed, scaly, and itchy due to chronic inflammation. Thickened or hardened skin, known as, we're going to see if we get this one, lipodermatosclerosis. Hey, I think I got it. The skin and the fat layer underneath harden and may feel woody to the touch. This affects leg mobility and increases the risk of ulcers. Speaking of ulcers, formation of venous ulcers. These are open wounds or sores, usually around inner ankles caused by poor circulation, and they are delayed tissue healing. They are slow to heal, prone to infect, and can significantly impact a patient's quality of life. Systemic symptoms due to poor circulation. While CVI is most noticeable in the legs, the conditions can have broader effects on the overall health, particularly if left untreated. Fatigue, general tiredness in the legs, or even the whole body due to the strain on the circulatory system. increased risk of deep vein thrombosis, DVT. Blood pooling in the veins increase the risk of clot formation, which can travel to the lungs like a pulmonary embolism or cause life-threatening complications. Chronic pain. Ongoing pain can lead to depression, anxiety, sleep disturbances, and difficulty maintaining a normal life. So how to understand what the symptoms are? There is a system called the CEAP system, CEAP classification. Medical professionals often use the CEAP classifications to classify chronic venous insufficiency. The CEAP classification is widely used for diagnosing and describing and managing chronic venous insufficiency. It provides a comprehensive framework based on C is for clinical signs, E is for etiology, A is for anatomy, and P is for pathophysiology. The system ensures consistency among healthcare providers when evaluating the severity of the venous disease and determining appropriate treatments. So let's get into it. Clinical classification, the C. The C in the CEAP describes the visual or physical manifestation of venous disease and is one of the most recognizable parts of the classification. The stage ranges from class C0 to C6. So for all of this, there are 6 classifications, C0 to C6, and we're gonna break down all of them. So classification of C0, there's no visible or palpable there's no palpable or visible signs of venous disease. Symptoms may include heaviness, fatigue, mild cramping in the legs. C1, this is telangiectasia and reticular veins. Telangiectasia are small dilated blood vessels close to the skin surface, often 1 millimeter or less in diameter, commonly called spider veins. I'd rather call it spider veins than the tela. I don't think I said it quite right. So we'll say spider veins. Okay. Reticular veins, slightly larger green or purple veins measuring 1 to 3 millimeters. They do not protrude above the skin, considered cosmetic, but may involve more severe venous disease. C2, varicose veins. These are when the veins are larger than 3 millimeters in diameter that are bulging, twisted, and easily visible under the skin, typically associated with pain, aching, or heaviness in the legs. C3, edema or swelling, persistent swelling in the legs or ankles without visible skin change. The swelling indicates the progression of the venous insufficiency as the blood pooling overwhelms the capacity of the veins. C4 is skin changes. At this stage, chronic venous disease begins to significantly affect the skin. C4A is depigmentation or eczema, skin discoloration, and irritation. C4B is the lipodermal sclerosis, thickening and hardening of the skin with fibrosis. Typically, you also can get a shiny white scars on the skin. C5 is healed venous ulcers, a history of venous ulcers that have healed after treatment. Your skin may still show scars, discoloration, or residual signs of previous scars. C6 is activia venous ulcers, open wounds or sores caused by poor circulation due to severe venous reflux. Ulcers are typically located around the lower leg or ankle and may be painful and prone to infection. So the E in CEAP is etiology. So the etiology identifies the underlying cause of the venous disease. This classification distinguishes between inherited, primary, acquired, secondary, or no known causes, congenital. So EP primary is when the condition arises without evident external factors. It is often hereditary or due to age-related vein weakness. ES, which is considered secondary, caused by an external event or condition such as deep vein thrombosis, trauma, surgery, or obstruction of the veins. EC is congenital, rare, present at birth due to anatomical or developmental abnormalities in the veins. And EN is no identifiable cause. The etiology is unclear and not attributed to any of the above. Next, we're going to talk about the A in the SEEP, which is the A is for the anatomical. So this is where it pinpoints the veins that are involved in the venous system, whether they are superficial, perforating, or deep veins. This is often determined using diagnostic imaging such as Doppler ultrasound. Superficial veins such as the small saphenous vein, the SSV they call it, or the great or long saphenous vein, the GSV. Deep veins include the iliac vein, the femoral vein, the popliteal vein, and the tibial vein. The perforators, veins that connect the superficial and deep venous system and play a key role in venous reflux. Other indications. When necessary, the systems may specify vein locations such as the abdominal or pelvic vein. The P in the SEEP. The P is used to determine the mechanism causing venous disease, whether it's due to reflux, obstruction, or a combination of both. So first one is PR, which is reflux. Reflects the reversal of normal blood flow due to dysfunctional valves within the vein. The reflux causes pooling, leading to symptoms like swelling, varicose veins, and ulcers. PO, which means obstruction, caused by a blockage in the veins, such as from a clot or scarring, forming deep vein thrombosis. Obstruction prevents proper drainage of the blood. PRO, which is reflux and obstruction. So it's a combination of both mechanisms commonly seen in advanced or severe cases of venous insufficiency. And last P is PN, where there's no pathophysiological abnormality. Sometimes no disturbance in blood flow is detected despite the symptoms. So let's go over, here's a snapshot of the category. C is clinical. So you have categories from C0 to C6, from no visible signs to active venous ulcers. E is etiology. And then you have EP. EP is primary. ES is secondary. EC is congenital. EN is no cause. And then you have A, which you have superficial veins, perforating veins, or deep veins. P is for pathophysiology. You could have PR, which is reflux, PO, which is obstruction, or PRO, which is a combination of reflux and obstruction, or PN, which is no abnormality detected. The SEEP classification is invaluable in customizing treatment plans for individuals. CO to C2 treatments may begin with conservative management like compression therapy or lifestyle modifications, while C3 and above are more advanced options, like you might have an ablation type surgery or sclerotherapy are considered to halt the disease. And C6 is usually a surgical management type case due to the severity of the condition. The SEEP classification allows healthcare professionals to evaluate the severity of the venous condition systematically and ensures consistency in diagnosis, treatment, and research. Early identification of venous insufficiency using the SEEP system can improve outcomes and prevent advanced complications. Okay, I'm going to go over some of the symptoms of chronic venous insufficiency. The symptoms you might have: leg heaviness, feeling of heaviness, especially after prolonged sitting or standing, swelling or edema, initially mild, progresses to chronic swelling that does not subside easily, pain or discomfort, dull or throbbing pain that worsens at the end of the day or after inactivity. Some of the symptoms: varicose veins or spider veins, enlarged or twisted veins or smaller superficial veins visible on the skin. Skin discoloration. You might have dark brown or patches around the ankles or lower ankles. Leg cramping, especially during the night after sitting or standing for long periods. Skin thickening, hardening, wood-like feeling of the skin known as lipodermal sclerosis. You might have venous ulcers, open sores on the skin, typically around the inner ankle. Fatigue, general fatigue in the ankles or body due to poor circulation. Itchy skin or dermatitis. So you might have red, itchy, or flaky, inflamed skin as a precursor to the ulcers. So chronic insufficiency symptoms often start small, like fatigue or discomfort, but progress over time if symptoms are left untreated and they persist. Swelling, skin changes, varicose veins. Early intervention can prevent complications like ulcers and infections. Recognizing some of these symptoms are key to health. Let's spend a minute to talk about what are some of the associated conditions of CVI. So one of the other conditions, varicose veins. Obviously, we talked about this. Swelling, bulging veins often seen in the legs. Pain, cramps, aching, or heavy sensations, usually worse at night. Deep vein thrombosis, blood clots in the veins, possibly leading to a pulmonary embolism. So that's one of the biggest things that you really got to be careful of if you're having this condition, that you don't, as they say, throw a clot, right? So one of the things in even in my office when I'm evaluating a patient is if I get to an ankle or a calf and it's hot and swollen and hard, you know, that's an automatic send out, get them out to the primary, get them out to the hospital, get them checked out, get an ultrasound to make sure there's no it's not a deep vein thrombosis, because one thing you don't want is have somebody have a pulmonary embolism, right? Is one of those clots can break off and then goes to your lungs and bad things happen. Okay, so let's get into segment 5, which is diagnosis and lifestyle changes. How is it diagnosed? Physicians typically use Doppler ultrasound to assess blood flow and identify leaking valves. Visual exams of symptoms like swelling and varicose also aid in diagnosis. Obviously, great history, great exam, visual exam, having a full understanding of what your symptoms are, what's going on. Are you having fatigue? Are you having the heaviness? Are you having the cramps? All that is critical to identifying. When you haven't talking about the quality of life, individuals with CVI may have trouble standing for long periods of time. The persistent discomfort can interfere with daily activities. It can affect your sleep, and in severe cases can lead to depression due to chronic, basically the changes in your legs, right? So you might have these varicose veins, and you might not like the way it looks. So typically, when we're talking about the treatment options for chronic venous insufficiency, we're going to talk about this is a progressive condition, right? But the good news is that it can be managed effectively with a range of treatments. The goal of treatment is to enhance venous blood flow, prevent complications, reduce symptoms, and improve the quality of life. Depending on the severity of the condition and which class you are on the SEEP system is where you're going to be treated for and what you're going to be treated for. So let's talk about the conservative, non-invasive treatments. Conservative treatments are often the first line of management, particularly for the mild to moderate stages. So classification C0 to C3, these approaches aim to improve venous circulation and reduce symptoms without the need for aggressive interventions. Typically, compression therapy, you're going to use compression socks or stockings and bandages applied to apply external pressure. You're basically going to put those compression socks on to tighten your leg. When you tighten your leg, you're going to increase the pressure and hopefully get that blood back moving up your leg. This helps increase the blood flow. So the benefits of this: reduces swelling, alleviates pain, prevents ulcers, and slows the progression down. Typically, most of them are over the counter. You could buy them in a lot of different facilities to help with that. So when we're talking about some of the next sets of stages, you're going to really want to identify what's going on, and we're going to get into some of the other symptoms. So lifestyle and home remedies. With the first C0 to C3, we're going to look to have some lifestyle changes, right? You're going to increase your mobility. You're going to elevate your legs, resting with your legs elevated above your heart, using pillows, usually 15 to 20 minutes, 2 to 3 times a day to help reduce the swelling. You could do it when you wake up, you could do it in the midday, and do it towards the end of the day. You want to stay active. Low impact exercises like walking, swimming, or cycling, or yoga, strengthening calf muscles to stimulate the calf muscle pump, which helps strengthen the blood flow going back to the heart. You want to avoid prolonged sitting or standing. Take frequent breaks to move around and walk. Weight management. Losing excessive weight can significantly reduce pressure on the veins. Dietary changes, right? You want to adopt a low sodium diet to reduce retention and swelling. You want to improve your ability to take in anti-inflammatory foods that are rich in omega-3s, antioxidants, fiber, and good cardiovascular support. You might want to start some physical therapy. Physical therapy could aim to strengthen your calf muscles, and which helps that natural pump. So they have this specific modalities that physical therapy uses to strengthen your ankles and calves and increase those motions and abilities, and help give you a pattern and give you some exercises you could do at home. Medications. There are certain medications can help manage symptoms, especially in cases where conservative treatment is insufficient. They include venotonic drugs. So there's a lot of different ones out there. It depends on what your doctor thinks is the best solution for you. They're typically used a lot in Europe, not so much in the US. Not exactly sure why, but they are in Europe. There's a lot of anti-inflammatory drugs utilized. The anti-inflammatory drugs are meant to help with preventing ulcers and dermatitis. And they also can use anticoagulation, blood thinners for increased risks, or if there's any thought of potentially having a DVT. What procedures are there for CVI? When conservative treatment fails or the condition progresses to C3 to C6, minimally invasive procedures are considered. These techniques are typically outpatient procedures requiring little or no downtime. Endovenous ablation therapy. What it involves is a catheter is inserted into the damaged vein, and heat energy, radiofrequency, or laser is delivered to seal the vein closed. The vein is eventually absorbed by the body, and the blood is rerouted through healthier veins. Best for varicose veins or venous reflux. Benefits: minimally invasive, highly effective, 95 to 98% success rate, performed under local anesthesia, and requires minimal recovery time. Sclerotherapy. What is involved is a chemical solution or foam is injected into the varicose veins or spider veins. This irritates the lining of the veins, causing it to close or eventually fade. Best for treating smaller veins or spider veins in category C1 to C2, and can also assist larger veins when used in, can assist in larger veins when used in larger concentration. The benefits: simple outpatient procedure, effective with multiple sessions. Microphlebectomy. What it involves is a small superficial varicose veins are removed through tiny punctures of the skin. Best for patients with localized varicose veins. Benefits: requires local anesthesia, and patients can usually return to normal activities in a few days. Surgical interventions are reserved for advanced cases, C4 to C6, where non-surgical options are inadequate. So this is when it gets a little bit worse, right? This is when the more advanced cases. Vein stripping and ligation. The damaged saphenous vein is tied off, which means it's ligated, and removed through stripping through small incisions. Best for severe varicose veins that cannot be treated with less invasive options. Next is venous bypass surgery. What it involves is similar to arterial bypass. Healthier veins from another part of the body are grafted to reroute blood flow around the block or damaged vein. Best for cases with major obstruction causes like thrombotic syndrome, PTS. Vein stenciling. What it is involved is a stent. A small tube is placed in an obstructed vein to keep them open and allow blood flow to flow frequently. Best for obstruction caused by DVTs or other conditions. Wound care for venous ulcers. Patients with active venous ulcers, category C6, require specialized wound care. Moist dressings promote healing and keep the wound moist but protected. Skin grafts in severe cases, and regular cleaning to debrief. How is treatment selected? Treatment is tailored based on the severity. Obviously, it depends on your doctor and what's going on with you. So typically, early stages C0 to C3 are typically managed conservatively, while advanced cases C4 to C6 are often minimally invasive, and then they become surgical as the categories go higher. Typical patient goals: cosmetic improvement, symptom relief, or ulcer healing. Overall health. Some procedures may be unsuitable if they're coexisting medical conditions. So obviously, without even having to be said, is each case is different, every patient is different, and your doctor will have to determine what they think is the best for each of the cases. Chronic venous insufficiency is a condition that requires a comprehensive approach to treatment, ranging from conservative management with lifestyle interventions and compression therapies to more advanced medical procedures and potential surgeries. Early diagnosis and ongoing management are critical for preventing complications like venous stasis, ulcers, or DVTs. Regardless of the treatment approach, a partnership between the patient and their healthcare provider is key for long-term vascular health. Little tips for prevention: regular exercise, especially activity that activate leg muscles, walking, yoga, stretching. Avoid sitting or standing for long periods of time. Take frequent movement breaks. Elevate your legs above your heart for 15 to 20 minutes, 3 times a day. You can wear compression stockings or socks and maintain a healthy weight. So to recap, CVI is a manageable but chronic condition. Early intervention and lifestyle changes can prevent its progression. There are a broad range of treatments options available. If you notice any symptoms like leg swelling, pain, make sure you consult your healthcare provider early. This condition affects your long-term quality of life, but the good news is the solutions do exist. If you know anybody who has any of these type of problems, please share this episode with them. One of your loved ones might benefit from some of this information. It is critical to start early, understand it early. And as always, the information I gave you is my opinion alone. Please do not take anything I say as treatment or therapy advice. You must see your own provider, your own healthcare provider for your own condition. Every condition is different, and your healthcare provider must make that determination for you. This is information only, in my opinion only. So as I always say, we only got one of these. Take care of yourself. Be healthy, because at the end of the day, your health matters. Be well. Next time, Dr. Michael Chillemi out. Have a great day.